Hi everybody, how you going? My name's Alistair Gray and I am going to talk you through this session of the history of healing, entitled What's in a Name, but really it relates to familiarizing you with the landscape, with the features on the landscape of this profession. And because of that, we're going to talk through what all of these different terms mean. In the previous session, you would have heard me talk about complementary medicine, about natural medicine, about traditional medicine, about alternative, integrative, and integrated medicine. And every now and again, I might even have naughtily interchanged those terms. Now, we've got to talk about that. We've got to talk about why those terms are important and really what they mean. That's the purpose of this session. We're going to explore the use of the terms and actually how they've changed over time and how they're different in some countries. We're going to talk about this in the context of the professionalization, the continuing professionalization of natural medicine as a whole, and especially the leaps that it's making, say, in Australia at this time. We're going to talk about it in context of scope of practice, not in any great depth, because you have a specific session later in this subject on what scope of practice means, and then later in your courses you'll have a even further session on scope of practice and staying within your skill set, staying within the scope of your professional skills. We're going to talk about these terms from the traditions from that point of view, and also some of the research which is out there. But most importantly, the exploration of the terms today. So if you, for example, enter into, let's say, Google, let's just try it in real time and see what happens. Let's enter into our search engine for the day, which just might happen to be Safari, and let's just play. Let's put in understanding natural medicine, can't spell it, medicine. Right? What do we got? We go to studentpulse.com, whatever this is, understanding the differences between conventional alternative medicine. We've got Wikipedia here, we've got something ortho info. Wonder what that means. Understanding Chinese herbal medicine, understanding herbal medicine for dogs. Now, as you know, Google, the Googleification of information, does something really interesting to us. We tend to just look at the top 4, 5, 6 options and make our choices or not. You know, we rush off and do another search. I think there was some amazing statistic around the billion hits that happen on Google every day, but the 98% of them that never go past the first page. So, if you have a look at this first hit on Google, you'll see understanding the differences between holistic, alternative, and complementary medicine. Yep, and where is it? It's in the International Student Journal. Oh, that's interesting. Who knows? Might even have a read of it myself at some point. What about if we just put in the terms complementary medicine? What happens? First hit, Therapeutic Goods Association Administration in Australia. That's the government body that regulates who we our medicines, our remedies. We've got a Wikipedia entry there, and then NICAM. That's interesting. What's that? Let's have a look. National Centre for Complementary and Alternative Medicine, and it's a US Department of Health and Services site. Complementary versus alternative. Let's have a look at what it says. Interesting, the image on the side of meditating young people. Complementary generally refers to using a non-mainstream approach together with conventional medicine. Alternative refers to a non-mainstream approach in place of conventional medicine. True alternative medicine is not common. Most people using non-mainstream approaches along with conventional treatments. Yeah, absolutely. That's absolutely the case. The boundaries between complementary and conventional medicine overlap and change with time. For example, guided imagery and massage, both once considered complementary or alternative, are now regularly used in hospitals to help with pain management. Why? Well, for a number of reasons. Because they're incredibly effective and able to be easily integrated into that conventional world. So it's very interesting, isn't it? This site, for example, just really nails the purpose of this quick discussion. It goes on to talk about integrative medicine as well. The array of non-stream healthcare approaches may be considered part of integrative medicine or integrative healthcare. Cancer treatments with integrative healthcare programs may offer services such as acupuncture and meditation to assist. In other words, alternative complementary treatments being integrated into mainstream care, and you start to see where we're going. Okay, now as well as integrative, as well as complementary, as well as alternative, we sometimes see the word or the term holistic as well, and they've been used interchangeably for a very, very, very long time. In fact, alternative medicine and complementary medicine are quite different, as you just read. Alternative instead of complementary, complementing, and holistic medicine. They're terms, and they tend to embrace larger definitions of a system of treatment and practitioners who do not work within the current systems of conventional medicine. All right? It's not a bad definition. Complementary and alternative medicine, this expression CAM that you hear quite often, CAM refers most of the time to complementary and alternative medicine. As you have just heard, most of the time is used to complement an existing option, complementary medicine. But a lot of people are trying to move away from the A part of CM. CM is not a great acronym to use because CM in some parts of the world is Chinese medicine, some parts of the world it's conventional medicine. So CAM, C-A-M, has been used for, let's say, a good couple of decades now. Some are trying to move away from it. For example, there is a university in Sydney, the UTS in Sydney, University of Technology, Sydney, with a research arm in the complementary medicine world. They talk about TCIM, traditional complementary and integrative medicine. It hasn't quite taken off as a whole yet, as a term. Sometimes we talk about CAM, but a lot of the time we prefer not to be talking about the A, the alternative part. What about the fact that quite often we talk about natural medicine? That's the word which kind of accidentally just rolls off my tongue a lot of the time. Very often I talk about natural approaches or natural medicine. What does it mean? Existing in or derived from nature, not made or caused by any messing around from human beings, in accordance with the nature of or circumstances surrounding someone or something. Natural medicine. Okay, well that clearly means something, natural medicine relating to nature, something that's not human. In other words, the idea that there is something in nature for our conditions, our ills, our symptoms at any given time, if we can just find what it is. But sometimes in the same breath we're talking about traditional medicine. Traditional, meaning existing in or as part of a tradition long established, handed down, folk, historical, unwritten and oral. Yep. Traditional medicine as practiced in Australia in the desert, or in tribal cultures, or in various places around the world, where there's a long folk or historical tradition, sometimes described as produced, done or used in accordance with tradition, habitually done, used or found. Traditional medicine. Yep. That's different from the term that we talked about before, which was part of CAN, alternative medicine. And one of the things you'll find still in the broad spectrum, the landscape of natural medicine around, especially in Australia, are those folks that are insisting that this is not mainstream, this is not conventional, this is alternative. It's a funny hangover from perhaps the 60s, where that kind of counterculture, really took hold, and there was a celebration of and a love of dropping out, getting out of the system. This is an alternative to this. Now, the way the wind's blowing at the moment is that is absolutely not the approach. That is not definitely the approach of most professional associations, say in naturopathy or Chinese medicine or homeopathy or nutritional medicine. Definitely not alternative. But you get, and the reason we're talking about it is because alternative refers to a medical system other than the normal one, the allopathic system. Allo means other in Latin. And so in some texts you'll see that alternative medicine refers to homeopathy, Chinese medicine and herbalism. But do you see that it's not really the case, because it's only alternative if you practice it as an alternative. Now, I learned homeopathic medicine 25 years ago as an alternative to conventional medicine, but I don't practice it like that anymore. I use homeopathic medicine integrated with other conventional medicines and complementary to those. So it's a different philosophy, a different way of coming at the information. So, do you understand that it's important to delve into and shine the torch around at these different terminologies, meaning of or relating to activities that depart from or challenge to traditional norms. I don't want your treatment. I don't want to put that stuff in my body. I don't want your drugs. I don't want this surgery. This is the speak of the alternative medicine practitioner. And really interesting that it's been led by the public to a great extent. An example is this. In 2006, I was doing my master's, and I did a piece of research which involved me reflecting on my clinical work and practice. Just going to have a slug of water here. Oh, better. And what I found was very surprising, amongst other things. What I found was that 93% of my clients, 93% were getting other treatments as well as mine. Now, had you asked me the question, what percentage of your clients are getting other treatments? I wouldn't have said that. I would have thought, maybe 50. But when I looked into the notes, and this was just from my notes, from 500 cases, so that's 6 months' work, 93% are getting chiropractic, getting supplements, Weight Watchers, doing the paleo diet. They're getting, taking melatonin. They're doing all sorts of other things. They're getting 5 massages a week. In other words, they did not see me as alternative. They saw me as a part of their team. Now, this is just one of the clear, changing, shifting perceptions of natural medicine, of complementary medicine. Do you see how my clients, the type of clients that are attracted to my practice, did not see me as alternative? And if I was an alternative medicine practitioner, then I wouldn't have seen very many of them, because I didn't want that. They like their doctor, and they come to see the homeopath as well. Yep. Now, in other parts of the world, the word that's often used is integrative. Integrative, meaning to, what is that? Integrate, integrative medicine. This is very popular in both the the USA and to an extent the UK, but mainly Europe. Now, these are treatments given in conjunction with conventional treatments and not in place of. So it's almost the same as complementary, isn't it? Complementary medicine prides itself on being non-invasive and non-pharmaceutical, but not all practitioners in this field of medicine are regulated or undergo training. So in the US and in Europe, the expression integrative medicine often means medical practitioners integrating what they want from the natural medicine world. right? Integrative. I am an integrative practitioner, they say. Now, the implication here is that they are integrating treatments into the treatment that they're delivering. It's very important. Now, that is slightly different to integrated, isn't it? And you'll get what I mean in a moment. Integrating complementary medicine often involves treatments, but also the philosophy of Western herbal medicine, the philosophy of naturopathy or homeopathy or Chinese medicine. Okay? Now, this is interesting because, in fact, what we often see in the disagreements between the way that natural medicine is delivered to clients is often about, is the philosophy being delivered as well? We can say as a general brushstroke that in some parts of the US, in some parts of Europe, integrative medicine is medical practitioners using complementary medicines in a conventional way. Does that make sense? In other words, without the philosophy, without the breadth, without the perspectives, without the holistic perspectives of naturopathy or Chinese medicine or whatever it is. Now, this is really important. Integrated sometimes means that the patient is getting conventional medicine and a complementary medicine practitioner is also being used to complement or integrate into that treatment plan. Now, that is actually quite significantly different. Now, the terms move and change depends on what country you're in at any one time. And if you're reading about integrative medicine, just have a good look and have a look at actually what is being delivered. Now, it might be a non-medical but professional natural medicine practitioner delivering naturopathy or homeopathy or Chinese medicine as part of an integrated team, say in a cancer clinic or something like that. So that practitioner will be doing the work, but very often integrative means that the doctor is doing it. Now, this goes to the heart of some of the issues that we've got in natural medicine. See, you're at a college, we're doing Bachelor of Health Science degrees, undergraduate, and at the end of it, you'll go and practice, because in Australia you can practice without being a medical practitioner. But in some other countries you can't. Say in the US, for the most part, to practice naturopathy you need to be an ND. Yeah? Or in Spain or in other places you need to have various qualifications. So some of these terms have been used and abused. They've been interchangeable, and it hasn't always been clear exactly what's going on. But a medical practitioner that's thinking and acting allopathically with a 2-week course in acupuncture is not delivering the same kind of healthcare as a medical practitioner talking to, sharing a treatment plan with a professional acupuncturist that's had 4 years or 6 years of training or post-grad training. Do you see? So, it's very important that we get clear about the breadth of what's out there, what's delivered out there. And we can be a little skeptical or grumpy at times, but fundamentally the position, the stance that we have at this particular college is that we're complementary to we are delivering complementary medicine to folks that are also very often getting conventional medicine. And we are doing it from our own unique philosophical standpoints as well. So it's not just a technique, it's a philosophy in addition to that. So at the college we've actually got a policy statement, and this is our stance on CAM, complementary and alternative medicine, at the college, also known as traditional medicine, and refers to the broad set of healthcare practices that have generally not been integrated into the conventional healthcare system that is dominant in the country they're practiced. CAM encompasses modalities, practices, and underpinning theories and beliefs used in the maintenance of health, as well as prevention, diagnosis, improvement, or treatment of not only physical but also mental and emotional illness as well. We have a holistic view and encompass therapeutic approaches that take into account mind, body, and spirit. Yep, the emotional world, the intellectual world, the physical world as well. Whole medical systems such as naturopathy, homeopathy, Ayurveda, Chinese medicine are complete systems in themselves. They have a theory, they have a practice, and they've evolved in a cultural context individually over time somewhere. And they are complete within themselves. The study of CAM at tertiary level, like at Endeavour or at a university, incorporates a rigorous grounding in science, in health science, and evidence informing practice. Why? Because it's important. And why? Because patients and clients demand it these days. And it's a far cry from 25 years ago. Yep, it's a long way from 25 years ago, because we've moved on from the 60s. We've moved on from the 70s and the 80s, from the shaman in the local community, in the village, or in the village in the city, where shamans and witch doctors and folk medicines and the local medicine woman did their thing. For a number of reasons, I'm sure the reason that you're here now listening, natural medicine has moved to a place where it asks for, demands, requires, and wants degrees and qualifications. Patients want it. Other healthcare practitioners ask legitimate questions and want to know what it is that you're doing, because their clients are also your clients. And so this is one of the consequences, the quick professionalization of our profession. It's a far cry from 25 years ago. Yep, I was going through a billowy white shirt phase. I don't know where my shoes were. That's me on the right, by the way. I was teaching anatomy and physiology at the Bristol School of Aromatherapy a long time ago. And I don't know what the CEO of the organisation might say if I turned up without my shoes these days. You can see the world's first laptop there. That has to be the very early 90s. On the left, there's me walking up the road with my teacher of homeopathic medicine. We're walking up to the pub for lunch. And sometimes lunch went for about 2 hours or more. The fields of Devon, that is, the green fields of Devon. The classroom was a converted barn. It was gorgeous. Lots of beanbags and meditation stalls, and a lot of Beethoven got listened to, and Mozart before class. A little bit different. It was a different ethos. It was a very different time, and it was learning from, in my instance, homeopathic medicine as a complete whole system to be delivered to this individual. But in the 21st century, in Brisbane, in Perth, in the streets of Sydney, our clients are asking for something else. Now, the other thing that it's important to remember is that all of our activities as our professions move towards this new paradigm of working, this new professionalism. It's crucial that we all stay within our designated scope of practice. I mentioned this before. Scope of practice really refers to two things. It refers to staying within our own personal skills, and that just simply means that if you're actually not equipped to deal with a patient, a client with bipolar, then don't do it. Yeah. But it also means something else. It means that as a profession, if you're a podiatrist, you deal with feet. If you're a dentist, you deal with teeth. If you're an accountant, you deal with money or counting stuff. Yeah. But in naturopathy, we deal with virtually everything in terms of health. In homeopathy, we deal with virtually everything. In Chinese medicine, we deal with everything. So the scope of practice discussion in our area is an interesting one. We're just touching base on it right now. But we are encouraged and encouraging everybody to stay within the scope of practice of whatever it is that we're learning. As you step into clinic, as you spend more time in the classroom and then practically in front of clients, you are going to be challenged to stay within your scope of practice. Practicing ethically, using the information that you've learned in the classroom, that evidence informing your decisions, and making sure that all of the ethics and legalities of what it is that we're doing are taken care of. This is just responsible behaviour in the 21st century. And then we're doing it with insurance backing as well. You see, clients in 2015 or 2010 asked different questions. Clients from 2000 or 1995 ask very different questions and have very different expectations of you. You see, when I graduated and going through my French white billowy shirt phase, I do not remember one client ever asking me the question, can you help with my my diabetes? Do you have any evidence? They inevitably said, I'd like to come and see you, can you help me with my health? And of course the answer back then was yes, not a problem at all, and off we'd go. You see, new clients being drawn to natural medicine, being drawn to alternatives or complementary options, have legitimate, different expectations. They have different questions, they have different needs, they have different desires, and these expectations mean that as we deliver our healthcare, we've got to be abreast of this change. You know, there's a homeopath famous homeopath in Canberra. All of his clients come to the house and he smokes the whole way through the consultation. What's your reaction to that? Interesting, huh? You see, I don't know, could we get away with that these days? I'm not sure. I don't know that would work in my situation. What I'm saying is that with new times and with the audience that's interested in naturopathy and nutritional medicine growing, that means it's a different type of person with a different set of expectations, with a different set of questions and a different set of ways of going about things if they don't get what they want. And that can be challenging for us all in our practices. Of course, we're passionate about delivering great healthcare and making change in someone's health and in their lives. You know, but what happens if we don't nail the problem the first time? What happens if it takes 4 consultations? What happens if they're not compliant fully? Do you see? The delivery, this is the art of natural medicine, not the science of natural medicine. But nevertheless, we're dealing with people with different ways of different expectations. These people are wanting us to integrate as opposed to be alternative. Back in the old days, our clients were hippies. It was no problem. Yep, hippies didn't ever grumble, but our clients do sometimes. So we're in an interesting time, we are for sure. We're in an interesting time where in our professions, this is Chinese medicine, naturopathy, nutrition, homeopathy, musculoskeletal therapy and Western herbal medicine, and in the other complementary medicines as well, where we are in this posture of holding on to and honouring the traditions of healing, where we come from. But we're in an age that values science and the randomised clinical trial. We're in an age that doesn't really quite get that we've done things the same way for thousands of years or thousands of times. Therefore, that empirical evidence actually is really important, is actually really genuine, is legitimate. So the attitude, the scientific attitude, that if a substance hasn't been tested scientifically, it isn't effective, we challenge that. And therefore, we find ourselves at the time in which we're in, where we find that research in complementary medicines is actually in its infancy, really. We find ourselves with areas in acupuncture or homeopathy where there is great research, but not spread, not heaps of research in all areas at all. And let's face it, it is sometimes, and you'll learn about this in the subject Foundations of Critical Inquiry, SOCH111. You'll realise that it is difficult to complete clinical trials or systematic reviews in some areas because of what it is that we do. We individualise all our treatments, and therefore that is a challenge to create a clinical trial around that philosophy. We have different dosages, we've got different traditions, we've got different mechanism of action with our energetic medicines as opposed to our pharmaceutical medicines. So here we are, interesting times. The scientific world in which we live demands cold, white evidence. Yeah? When you go to the doctor and the doctor says, I'm going to give you this, or I'm going to do this, it will be, theoretically, based on a piece of research and evidence-based medicine. Yeah? As opposed to the traditions of natural medicine, which is that my teacher taught me this, and my teacher taught me that, and my teacher taught me this, and my teacher taught me that, and my teacher taught me that. Our own traditions, say in spiritual healing, where the elders of the tribe pass on their amazing information down the line. Now actually the truth is not quite either of those two things, because in complementary medicine we've moved towards being able to provide and a willingness to do great research. And in fact we know that in a GP's daily practice 50% of the interventions are not evidence-based, and we know that from the the British Medical Journal article published in 2010. Beautiful article about that. So traditional evidence, still evidence, traditional evidence, procedure-based, based upon provings, case studies, systematic observations. Yep. And you know what we call this? We call this inductive logic. Induction. Bottom-up logic. You make a generalization up to individual instances. This is what we've done for thousands of years in healing. As opposed to deductive logic, top-down, which is used now today in science, using general statements to work down to more precise logical conclusions. Both valid, really at the end of the day, both crucial, very often leading to very, very different conclusions, actions, courses of actions. So interesting times, isn't it? Bachelor of Health Science degree, science, health science, that's what we're delivering, but we're also talking about and honouring the traditions of medicine, the traditions of healing as well. In the inductive world, of course, you don't do a clinical trial to work out what to do. You talk to your mentor, you talk to the guru, you learn hands-on. There's no such thing as a textbook. And it's just interesting times when we consider that the apprenticeship system, which has been going on in the traditional medicine world for centuries, is now in an interesting time. Here we are teaching you at Endeavour College, not an apprenticeship, but a curriculum, yeah, with both. We've got textbooks and a hands-on as well, hopefully coming to a very happy medium. And of course responding to all sorts of different learning styles as well, because the reality is you're an individual with a different and a very specific learning style. Our patients that come to us have got very individual symptoms and dramas going on in their lives. And what we are wanting to do is deliver individualized, tailored healthcare, targeted healthcare to relieve their symptoms, to relieve their suffering, and to create better health for not only the individuals but the communities that they're in as well. All right. that is it for this week. Okay? Take care out there, and see you soon.